men tend to neglect their health. There's been a movement, I think, in the past 10 years to encourage men to focus on their health. Consequently, we as urologists become the men's physician. The Division of Male Reproductive Medicine and Surgery at Baylor College of Medicine is a division of the Department of Urology. It was started in 1998 and actually represents the first division of its kind in the United States, incorporating both clinical and basic research as well as a focus on patient care. It primarily consists of three areas, that is male infertility, erectile dysfunction, and hormone therapy for men.
I have been with Dr. Lipschultz's practice since December of 2005. One of the biggest changes I've seen since working with Dr. Lipschultz initially is men have now become more open to talking about their sexual issues, and it's been more of an acceptable practice to come to the doctor to talk about it and receive treatment.
There's not a better field of medicine than sexual medicine. Sexual medicine is the best barometer of a man's overall health. I'm in the business of improving quality of life, and sexual medicine is really improving men's quality of life, and it makes a big difference on these patients. The technology here at the Neo Quinn Tower is fantastic. We have new microscopes that we use now for infertility procedures such as microtestes and testes. We have new lasers, we have new scopes. The technology is just fantastic and really glad to be a part of it.
We have just moved into a new day surgery center, which affords state-of-the-art technology and allows people who come to the operating room with us for learning to watch what we're doing on multiple video screens. So it really has been a great asset to our teaching agenda. We now have trained over 115 fellows. We have 2 fellows at all time on the service, as well as a resident and often medical students.
One of the most unique components of our fellowship training here is our training in microsurgery. So obviously I've had the profound and wonderful experience in learning from the master in the field, Dr. Lipschultz. So not only do we get to participate in microsurgical cases at least 5 times a week, but we have a great microsurgical training facility here with pretty much the exact same microscope that we use in the operating room, but it allows us sort of extra time to hone our skills and sort of refine before we're actually performing the procedure on a patient, which is really nice.
Within the Department of Urology, my primary role is as the clinical lab director, and it's directing 2 clinical labs that focus on male factors. There's one that specializes in hormone analysis and the other one that specializes in sperm testing and to help to identify the underlying causes of males' presentation of male infertility. The most interesting findings that I've gotten in the last several years through my collaborative work with Dr. Lipschultz has been the identification of new genes that, when mutated, are most likely causing infertility in the men that we had sequenced. And also, novel mutations in known genes have also been identified.
This practice is unique because there's several ways that you can actually feel very rewarded as a provider. Maybe you get that baby photo from that couple who's been trying for a long time. Maybe you've helped that gentleman have a better sex life with his wife. Or maybe it's just helping that executive who's exhausted and can't make it through the day, and you find out it's just low testosterone and we can treat it. These are the things that help us remember why men's health is so important in medicine.
We're now looking more globally at establishing an actual men's health center. And we will be doing so formally in the next 6 months, bringing together both our clinical research, our basic research, and our clinical accomplishments to focus on a general clinic just for men's health.
A potential patient could come to us and have all of their health needs addressed really in one center. We would bring in all the necessary consultants to provide for all health needs. So we're very excited about that opportunity from a clinical standpoint, and from a research perspective, There are many aspects of men's health issues that are very common and very important, for which we need a great deal of additional knowledge. And we would partner with all of the strengths of the basic science departments and all of the various medical disciplines at Baylor to push forward in a research perspective, in addition to what we offer clinically. So for all those reasons, this is a very important area of emphasis for us at this time.